Good evening for today, my beloved colleagues. Hope all of you are fine in your health. And this is my humble introduction to all of you. We're going to discuss today the planning of focused clinical examination. And this is the name of our institute, and this is the topic. So one important point of the OSCE station is the planning of the clinical examination. Try to understand the word planning of focused clinical examination. It's not simply doing some clinical examination, what we have learned in our graduation life, or even in post-grade other examination like PACES exam, for example, in the MRCP. Here in the PACES, those you are having any experience of PACES orientation or the appearance of the examination, you understand that there are some stations for a complete clinical examination. Suppose exam in the chest, exam in the cardiovascular system, exam in lower limb for in the neurologic point of view, exam in the abdomen like that. But here the word is not like that. Here is the focused clinical examination. Another word is targeted clinical examination. How to select the target? That is our plan today to discuss. So now look at the patient. Today we are not actually practicing the case. Already we have done some practice related focused clinical examination in another class. It is also available in our link. You can see later on if you need, but we are trying to give you some hints of planning to create the philosophy, to create the understanding. So we are giving a direct information. Like in station, you entered and this is the patient in front of you. In the last class also, possibly you can remember in maybe a few weeks before, that's the case we discussed. So we put the same cases for better understanding. So all of you can see that this is a patient, Mrs. Sajida Akhtar, aged 30. When you entered, what was her complaint and some vital features, vital signs given. And you marked that your patient having tachycardia. Now you're looking at the patient. And I believe that your diagnosis is almost certain. I like to say almost certain. Now, I am asking who can say the diagnosis? More probably only by getting the informations and looking at the patient. More likely diagnosis. Most probable diagnosis.
Graves.
Dr. Manal.
Graves.
Dr. Manal, one by one, please. Dr. Manal, can you tell again?
Graves. Thyrotoxicosis.
You are telling Graves' disease, right?
Yes.
Very right. Do you like to add anything more? Graves' disease with anything else?
Was high sign.
Yes.
Dr. Manal, first please, then other colleague. Those who want to talk, be connected by the audio, please. I will come to you. Otherwise, I may forget. Please, Dr. Manal, what other diagnosis you like to add?
How a Graves, there is eye sign and swelling of the thyroid.
No. You got some sign only by inspection. This is right. But do you like to add any other things in this case? More likely or probability, other probability, Graves' disease with?
No. I
No.
don't know.
Now other colleague. Dr. Manal, be connected. Dr. Possibly who open the mic, please come forward. Some other one. Dr. Nada, please, what you were thinking?
Thyroid eye disease.
Thyroid eye disease. This is also under the headline of Graves' disease. But if you want to extend the eye features of the hyperthyroidism, you can say, right? Eye features. Let's see, Dr. Afag Idris, what do you want to say? Dr. Afag Idris, your voice is not clear.
Squinted.
Disease with eye manifestation or thyroid disease, grave disease with exophthalmos.
Exophthalmos is part of the Graves' disease. So Adding the exophthalmos will not be meaningful. There may be some other things also if the case has complication by the Graves' disease in the eye. I will come to, or we will come to this point a little later. But why not we are saying it may be a case of Graves' disease with hyperthyroidism. If you don't understand my point, you can ask me now, please. I want to say it may be the probable case. Tachycardia is the features. Yeah, Dr. Mahavib, you open the mic. Yeah, Dr. Mahavib, possibly.
Yeah.
What do you like to say? What do you like to say?
Tachycardia, sign of hyperthyroidism.
Yes, there may be other signs of hyperthyroidism. So is a diagnosis will be very easy and clear also, right? But very intelligent doctor will search something more. Let's see. And you will remind me what something more if I may forget, please, you will help me in the later part of the discussion. Graves' disease with hyperthyroidism with other. I will let you know later on. First, up to these, we will make a plan to diagnose. But this lady may not be there. May not be there means just suppose there is no other features to be inspected, or you are looking a patient apparently having no problem in the inspection. If it is so, and patient is not telling that patient having, I am just removing from the instruction. Please look at. This is the informations. Please look at. I just remove some message from there. Patient is only telling, I am having some palpitation. That means the racing of the heart. Nothing else. So you got the tachycardia and getting nothing. Again, will it be hyperthyroidism? Please answer anyone. It is just an additional question to you. Possibility I am asking. Patient complaining, palpitation or racing of the heart. You got the tachycardia. Will it be, I mean, there may be many differential diagnoses, but could it be again a female patient? Could it be hyperthyroidism?
Yes.
Yes, very right, very right. But could it be Graves' disease without goiter, without exophthalmos?
No.
No. Yes, no, really. This is the intelligent answer. Thank you. Thank you very much. So now come to this patient again. And I am coming back. Yes, this is our patient. This is our patient. Thanking you just to interact with me. So I believe that all of you try to interact like this. So now in this examination plan, you came to know that we have to see some general examination that is relevant with this patient's symptom with some signs. Already you got some sign, tachycardia and the appearance of the patient. So keeping this in your mind, now please make a plan for general examination and systemic or local examination. May I request all of you to write in a paper now for a few seconds. And quickly write down and tell me what you have planned. Please, doctor, if you don't do, you will not get benefit today. This is very discussion and interactive session. And open the mic and tell anyone, please, that what you like to go for points of general examination. Not all general examination. Again, we discussed already before. Some points from general examination. Who can say, please, open the mic and come forward. Please, anyone? I will guide you also, no worry. Dr. Manal, yes, thank you. So, Dr. Manal, I will like to hear from you some points of general examination and some points of systemic or local examination. Hopefully you are ready to tell, right? And we will include other colleagues also if they feel interest, no problem. But you will be connected. Don't switch off your audio, okay?
Okay.
Now you tell, please. General examination points. Dr. Mahavib also come forward, no problem. Yeah, Dr. Manal, what general examination points? And all of you other colleague, please try to remember. If you want to add also in the general examination point, you can add. Or if you want to argue against, you can argue also against Dr. Manal. I think she will not mind. That he will tell that, okay, this sign is not important. I will help my best to make the discussion perfect. Dr. Manal, please, one by one.
Okay, I will check the pulse, the temperature.
Already given, doctor. Remember in the exam, what is given there, don't repeat. Okay? You already got it. Something. Now tell remaining part.
Okay, I will look to the skin, to the lymph nodes of the lymph
Or
nodes. And
I will show you. It will be useful for you because patient is in front of you. It will be easier. Now you tell. What again, please?
I will
Lymph
check
nodes.
lymph nodes.
Please give me a few seconds also. I will write also. Sorry, I need the paper. What you are telling. Okay, lymph node you say. Okay, then?
I will check the hair, the skin.
Hair. Skin. Okay, then?
The gland itself, thyroid gland.
So you are coming to the local examination or systemic examination?
This is local.
Local. But what else in the general examination?
I will check the lower limbs also for any change in the skin or anything.
Lower limb for what?
In the
part of general examination, you mean in the lower limb? As a part of the general examination in the lower limb?
Yes.
Okay, what else in the lower limb?
To the heart.
No. Sorry. In the lower limb, what do you want to examine? You say the name of the sign.
Skin change in the lower limb.
You already told skin change, doctor. Overall, maybe upper limb, lower limb. Then?
I can't remember.
You can't remember. No problem. No worry. I think we can remember. Some of your colleagues are ready. You just finish your plan. Then any other thing in the general examination?
I will listen to the heart. And,
come to the listen. Come to the heart. Heart for what?
For
heart means you will tell the chest examination, right? As a part of the chest examination, you will listen to the heart. Okay, then other plan? Other than heart?
No
one. Thank you. Dr. Afag, what you like to comment or add?
As a part of general examination, I will examine in the leg for this mixed edema and for reflexes.
Mixed edema, that's good.
And for reflexes.
Mixed edema means actually pre-tibial mixed edema. Yes, Dr. Afag, any more? Very good. Any more?
Also for
one by one, please. Dr. Afag, let Dr. Afag say. Dr. Afag, any more?
Reflexes and the reflexes.
Reflexes in the limb. Yes. Very good. But it is very important in the hypothyroidism. Delayed relaxation of the ankle jack. This is the typical word. But we are thinking hyperthyroidism. We will be expecting there may be exaggerated reflex. Okay, very good.
Hyperreflexia, yes.
Yeah. Then any other thing?
An examination of is part of the general examination for hand, for more.
Hand for what?
For warm skin.
Warm skin, right? Sweating, you means warm hand.
Sweating,
warm hand with sweating. And any other thing in the hand?
Tremors.
Dr. Manal, now you can remember. This is the thing, doctor. This is the thing really for the benefit of group discussion. Right, Dr. Afag, you finish first, then we'll come to other colleague. In the hand, any more?
Clubbing also.
Clubbing, doctor, clubbing.
Yes.
Then any more? Any more in the hand? I am now guiding you. Any more in the hand?
Sweating of the hand.
Now Dr. Om Muhammad is here to add something. Yeah, Dr. Om Muhammad is very excited to say. What else? In the hand?
Sweating of the hand.
Sweating already told, doctor. Dr. Om Muhammad, your mic. Please open the mic. Dr. Iram here again, open the mic. Please.
Palmar erythema.
The tremors.
Palmar erythema, yes, you can say. Any more? Tremor, right. Very good. Very fantastic. Any more in the hand?
Thyroid acrobacy.
Okay, acropechy already part of the, somebody said that the clubbing. Any more?
Pulse.
Doctor, who said? Someone? Dr. Amal maybe telling something. Dr. Amal.
Also,
Reynolds was excellent.
Sorry, I cannot hear. One very
also for the proximal myopathy, I will ask her
proximal
to do-
myopathy. Oh, very intelligent talk
Yes.
you are telling. Proximal
Yes.
myopathy, yes, part of examination of the upper limb as well as lower limb is a part of the
Yes.
musculoskeletal examination, or we can say as a part of the neurologic examination also, but more likely musculoskeletal examination. Very good. Then Dr. Nada,
Maybe there is a carpal tunnel.
carpal
If
tunnel in
hypothyroidism.
yes, mainly in the hypo, but we are dealing a case of possibly hyperthyroidism, right? So we are not doing the carpal tunnel examination, and patient is not complaining hand pain also, remember. Okay, so the complaint will guide us for examination planning. Please, there are many other plan. It's a very big chapter rather in examination, but we will try to make our examination plan very concise, meaningful, and time effective. You can say maybe 10, 20, 30 signs also. Can anybody else to add something more? No more. No more. If I say very tricky things given, if you look at the vital sign given, what is the pulse? Dr. Manal, help me please. Can you see? What is the pulse?
110.
Could it be that this hyperthyroid lady may have atrial fibrillation?
It could be.
Possible. It could be. So just bullet, you understand the bullet is going near your ear. Understand? Bullet is going near your ear, but it is not hitting. It means you are telling tachycardia, but you will fail to identify atrial fibrillation if you don't look at the rhythm of the pulse. So this is the tricks given there. They are not mentioning in the vital sign the rhythm, but this is your job to see the rhythm of the pulse. Do you understand, Dr. Manal and others?
Yes.
So it includes many other things in the hand. So you completed your hand examination and now come up to the neck to see many other findings. You may come to the eye, you may come to the neck in this case. You may see even other parts of your examination, and you come down to the abdomen, not mainly abdomen, you come to the lower limb also, especially to see some neurologic exam, as well as to see the predibial myxedema also. Now, after this planning, if I show you a planning chart, please look at, I'm not sure, can all of you see all the points here? Dr. Manal or other one, please, can you read it? Dr. Afag, can you read this font size is enough to read each and every point? Each and every point. Doctor, please be connected. Anyone with me who are free? Dr. Manal, yeah. General observation, already general observation, you started from the beginning when you were talking, right? By the picture. Overall, we have to include hand up to toe. So you started from the hand, come to the face, neck, skin, joints, and surroundings. And one by one, appearance, cooperation, build, decubitus, already a big list is there. Please, silently, each one be seen by all of you. Dr. Manal also. Dr. Manal, can you read it for everybody? I can get little rest also for a second. One by one. And everybody think one by one, what will be relevant of our case today? Please, Dr. Manal.
Okay, appearance, cooperation.
Dr. Manal, you think appearance is important?
Yes, she may be thin
Yes,
because
yes, already you already seen appearance. Next.
Cooperation.
It is important directly.
Maybe she's nervous or irritable.
Usually hyperthyroid patient will not be that much nervous that she will be uncooperative. But there is another complication, thyroid storm. Is very exceptional and extreme case of hyperthyroidism. At that time, patient may have some neurologic expression. In that case, cooperation may not be there. But I hope in your OSCE exam, that much extreme case may not be there in the thyroid. This is the flavor of OSCE. Okay, then
Built.
important.
She's thin يعني you mean right?
No.
Built what? Body built يعني?
Yeah, body build.
Okay.
What
She
will be the
will-
body build in this hyperthyroidism?
Important.
Is there any feature expected in under the body build? Thin. Patient may be thin, right? Weight
Yes.
loss. Yeah, weight loss will be there. Weight loss. So you may find that a lean and thin lady. It may be part of your diagnosis. Then quickly, doctor. Switch one by one.
Decubitus.
Is much important for your diagnosis.
I don't know the meaning actually.
Decubitus. Oh, sorry, doctor
Cannot
is a very
remember.
traditional word.
Cannot remember.
The position of the patient on the bed or on the chair, patient prefer most. That means in some diseases, patient prefer a specific posture of the
Position.
body, lying, sitting. Suppose pancreatitis patient have a bending forward position like that.
Yes.
So it is directly related?
No.
Less related. Good. Then
IV cannula.
IV cannula might be, you may get, but in your general practice of family medicine, this cannulated patient may not be there because you are not dealing an hospitalized patient. Okay, not important.
Hair change.
Yes, hair change. Why hair change important in hyperthyroidism? And already possibly you said before that
yes,
you will
I
see the
said,
hair.
but I mean
What is the explanation?
hypothyroidism. It will be brittle and hair fall.
In the
but this is
hypothyroidism.
hypothyroidism.
But in the hyper also, is there chance that patient might have hair fall?
A little, yeah, not like hypothyroidism.
Can anyone say? This is very vital discussion, doctor. Please be connected. If you can make such planning, it will be a golden opportunity for you to plan each and every exam of each and every case in your OSCE. Who can say about the hair?
Hair thinning.
Hair thinning in which condition? It is in the hyperthyroidism, or will there be any added other autoimmune disease more likely?
Psoriasis.
No psoriasis. Like other, this will be autoimmune thyroid disease, right? It's not? Suppose Graves'
Vitiligo, yeah,
disease.
vitiligo.
No,
لا vitiligo
hair
is
fall.
skin.
You say about the hair
sorry,
fall relevant. How it is
alopecia.
alopecia, how it is relevant as part of autoimmune disease. No, another disease may be associated with hyperthyroid, with Graves' disease here. That I wanted to say before, extended diagnosis, like a specialist, not as a GP, but GP can show his or her glamour, extended understanding. It could be added as SLE. Clear now? SLE, systemic lupus erythematosus. Alopecia may be one of the features. So it is an extended, it is a boundary, you understand, Dr. Manal? 6 in the cricket boundary, over boundary. If diagnosis will be over boundary diagnosis, if you can correlate, but even then there may be hyperthyroidism, there may be some skin changes. So hair is a part of the skin anyway. Then the pallor. Pallor means anemia. Indirectly looking at the pallor, but you will see the anemia as well, is important. Please give me few minutes time so that I can explain each and every point, doctor. I am also hurried, but I like to stay here in this slide. Pallor. Is it important?
Disease, yani anemia of chronic disease? I don't know.
No. Pallor may be associated with again other autoimmune condition. You know the vitamin B12 deficiency in the pernicious anemia? One condition, right? And in the pernicious anemia, you know that there is a development of the antibody. So it may be associated with antibody disease. Again, it is overbounded diagnosis. That means extended diagnosis. Okay, plethora. Plethora means red face.
Redness.
Is it important?
Maybe related also
Maybe
because
better not to say, ignore it. For
ignore it.
example, ignore it. If you cannot correlate directly, you can ignore it. Then in the skin change, petechiae, that means the bleeding point, purpura, ecchymosis, bruise, hematoma, rashes, pigmentation, depigmentation. Which point is more important in the skin? Maybe depigmentation as a part of the vitiligo.
Vitiligo.
Right? Okay, pick it up. Remember in your examination plan, and then come to the anemia, jaundice, other eye changes, nystagmus. Which is important?
Eye changes. Yes.
No. Which eye changes? Already you have seen the eye changes.
Exophthalmos.
Exophthalmos already you have seen. What else you like to see in the eye changes? Who can say? Who can say? Who can say? Will there be any problem in the extraocular muscles in the Graves' disease?
Squint.
There will be retrobulbar deposition of the tissues and the enlargement of the extraocular muscles. And there will be diplopia as well. Okay, doctor? And there is a compression of the optic nerve. There will be vision problem as well. And it will be the red flag in this case. Eye change, not only the exophthalmos here. And these complicated eye findings is called malignant exophthalmos. Okay? Malignant exophthalmos. And it is relevant. I will come to the summary later on. So these eye change is also important, not the nystagmus. Nystagmus is a neurologic feature relevant with the cerebellar disease or others. Now come to the clubbing. Important?
Yes, it's related.
Already discussed. Colonychia, leuconychia, and other nail changes. Important here? Directly?
No.
Not much. Now come to the cyanosis, gum changes, tongue, teeth, other oral cavity features. Is there? Relevant? Not much. But if there is vitamin B12 deficiency, tongue may be important. Is tongue important? Associated B12. Yes, there's a raw tongue, you know, smooth tongue, smooth surface of the tongue. Dr. O. Muhammad, anything you like to add?
No, I want to say hypoglossitis.
Yes, glossitis is the raw tongue.
Yeah.
Raw tongue or a smooth tongue? Smooth tongue.
Smooth tongue.
We have to say raw filling. Filling of raw, filling by the patient. But you will find there as smooth tongue. Okay, Dr. Muhammad, please check your audio. Your volume is low. If you want to say, take care of this. Now come to the lymph node and thyroid. Doctor, why lymph node is important? Dr. Manal said before.
Yes, maybe there's inflammation or
inflammation. It is a less common. Though it is an autoimmune disease or others, less common lymph nodes. But any enlarged thyroid gland, we need to include lymph node examination. If it is a malignant thyroid enlargement, definitely it will include the lymph nodes. But in here, lymph node is not that much important. But as a part of the goiter examination, we need to include the lymph nodes. This is right. Okay. Then you understood the thyroid examination well. Then come to the next point. Edema, dehydration, JVP. Can it be anything important? Can anyone correlate with edema, dehydration, or JVP? Of your case, probable case, Graves' disease with hyperthyroidism. Okay. Can a patient have heart failure if it is hyperthyroidism long-standing? Patient already developed the atrial fibrillation in between. Now patient comes with the heart failure. Possible?
Yes, possible.
Dr. Muhammad, audio. Yes, possible. So again, it will be your excessive diagnosis, overbounded diagnosis. We are not busy with this that much excellent or extensive diagnosis, but it is possible. It is possible. Now pulse, blood pressure, temperature, respiration. Which is more important? all are more important. How respiration is important in this patient as a Graves' disease. That means the breathing. Can it be that the thyroid gland is compressing the airway? Possible?
Maybe.
Maybe. Then patient will have the
Yes.
breathlessness, right? Right?
Yes.
Yes.
Sweating.
So already pulse we described, right? Arrhythmia and others. Blood pressure may fall as a vital sign. Temperature may be raised. Okay. Now come to the breast point. Is breast important directly with hyperthyroidism? Breast examination? Not much. Not more important. Okay. So you see, there are many points you can include for your suspected diagnosis. And come to the focused examination. Sorry, the systemic examination, definitely you included already endocrine part as a thyroid gland. Now you come to the systemic as cardiovascular. Dr. Manal said, precordium for cardiovascular system in the chest. What cardiovascular you like to add? What cardiovascular finding? Dr. Manal disconnected. Can any doctor, any colleague be added now to interact with me? Otherwise, sorry, I cannot proceed, doctor, without asking you. Dr.
Auscultation,
Iram.
heart sound auscultation.
By
And
auscultation, what, doctor? By auscultation, what finding you are expecting?
if patient in atrial fibrillation, heartbeat is
Heartbeat.
irregular.
Okay. If you say I want to see there any irregular heart sound, right?
Yes.
But it means that you are duplicating the same finding what you have got in the pulse. Is it?
Yes.
You got already irregular pulse. So you are getting the same message in the auscultation by irregular sound. So only for this, you will waste your time. But if you see, if you have time, enough time, it is nice to have double check. Okay, any other thing?
Grafts.
Correct.
Failure.
Yes. Yes. If we think that patient have heart failure, especially the edema is there, GIBP is raised, right? GIBP is raised, and patient complain also breathlessness. Okay. So basal crepitation will be important. If it is the thyroid case, though, again, breathlessness may be part of the compression of the airway. It may not be heart failure also. So if patient complain the breathlessness, so it may be problem in the respiratory tract, or it may be problem in the cardiovascular system in the precordium. So now how extensive we can think by our probable diagnosis. Okay. So after finishing the precordium, where we will go? Dr. Iram, why you disconnected audio, doctor? Please. Anyone be connected, please help me. Anyone? Yeah, Dr. Iram. Then where will you go? You already finished hands. You already finished face. Look at the part already in the upper black box. You already finished, if needed, other cranial nerves. Already we discussed about the optic nerve, vision problem, cranial nerves. If possible, fundoscopy. But here fundoscopy is not much important. Not much important. You have already seen the mouth or ears. Possibly it is not directly relevant too much, but in the mouth cavity, you already wanted to see the tongue. Okay. In the neck, thyroid gland. In the chest, you finished. Okay. And now come to the abdomen. Anything to be seen in the abdomen? Dr. Iram or Dr. Manal, anyone be connected?
Ascites.
Yes. Aside is not always. Actually, the edema, GBP, basal crepitation will guide us to see ascites. Otherwise not. One examination finding will guide us to see the next examination. If it is so, we have to include many other things. Okay. My request to all of you, don't be puzzled, doctor. Today I am here and I got the opportunity to make you extensive thought process to develop with you. So try to do it and it will be helpful for each and other cases, doctor. So be careful and connected. Then come to the lower limb. Dr. Manal, lower limb. Already leg edema. If you didn't see, you see now. And then status of the circulation, arterial palpation and others. So circulation is not much important in the thyroid case already because you have seen in the hand, pulse, rhythm, already you have checked. Okay. And the circulation, no need to duplicate the signs. Okay. And the musculoskeletal and the neurology. So Dr. Manal or Dr. Iram, you can add musculoskeletal and the neurology in this case.
Reflexes, lower
Yes.
limb reflex,
Good. Then
and
already someone said the proximal myopathy in the lower limb also, right? Just to tell the patient, can you sit down for me and stand up without supporting with your hand? It will give you the findings of proximal myopathy. Even we can ask in the history also about the proximal myopathy. Okay. Simply up to this. And the sacral edema, if patient is lying on the bed, then sacral edema is important. But your patient will be as a GP, it will not be admitted patient. This patient is a mobile patient. So sacral edema is not much important in your case, any case. Okay. And in addition, in the bedside examination or bedside test, look at in the right orange box. Okay, bedside examination including the vitals. Already blood pressure given, temperature given, height and weight important in this case.
Yes, BMI.
Yes, you will get the low BMI. Okay. Typistic urine test is important. To check the protein, to check the sugar in the urine or other findings by tip test, typistic urine. This is also your bedside, not bedside, your chamber, side room test. You can do if you want. Yes. Suppose again autoimmune accumulation, extended diagnosis. If patient have type 1 diabetes, that is the, for example, associated. So there may be sugar in the urine. Again, capillary blood glucose important? Yes. To see the diabetes or not. Capillary blood glucose by the glucometer. Do we need ECG? Do we need ECG in this case? Yes, if I suspect atrial fibrillation, this is mandatory must. In your word, lazim. Right, Doctora?
Yes.
Lazim. ECG lazim. Though you will include your investigation plan, but actually these are bedside or side room tests which are available in your chamber. SpO2. Is it important anyhow in this thyroid patient with goiter?
There is the swelling and the breathing difficulties, no?
Yes. If any breathing difficulties, again, this is mandatory. SpO2. Peak expiratory flow rate is important? No. Rather, spirometry will be important. Or another investigation also, we say, though it can be done in the bedside, it is called lung function test. Though I didn't write it here because to make you more puzzle or extensive. The spirometry, you know, FEV1 and forced vital capacity. This is actually bedside test. But in our practical life, especially in South Asian perspective, we can include these dipstick, capillary blood glucose, ECG, SpO2. SpO2 easily is a small meter. Peak expiratory flow rate and spirometry, we can include in our investigation plan. Understand, doctor? Yes. Because with the any patient, we need to do some investigation plan. So you can include there. Just in this long time, we try to explain you the relevance of planning examination. That means the focused examination plan. But now all of you understand, if I make this exhaustive plan, is it possible to be completed in 2 to 3 minutes? What do you think? All of the things, Dr. Manat?
The cranial nerves and the reflexes will
Not
take.
possible. Simple answer. Not
Mm.
possible. Not possible. So how to make it useful? By managing your time. Okay? Managing your time. Suppose if I start from the beginning. So for the appearance, no need to extend time. Already you were talking, you understood appearance, cooperation, built on an average, decubitus, IV cannula, hair change, pallor, plethora. Already you have seen, and even not 1 minute important here for all of the thing. Skin, you are looking directly in the skin. So no need to examine further. But in the anemia. So if you check the anemia, it may take few seconds. Jaundice not needed. But come to the eye, look, or if you ask, is there any problem of your vision? Enough. But for the optic examination, light reflexes are the thing. If you don't have time, no need. I'm telling no need in a sense to manage your time. Only asking the vision problem is enough. Then patient will tell you that, doctor, I can see the double. Or doctor, I can see less. This is malignant exophthalmos. So if you look at the clubbing, coilunaca not important. So one you can add as a clubbing. Then you can see in the tongue. Then come to the lymph node or thyroid gland examination, edema, dehydration, JBP. I believe that it will not take too much time. But pulse, irregularly irregular or not, very important. If patient does not tell the breathlessness, respiration examination not important. If patient does not tell the breathlessness, basal crepitation in the heart also not important. And even if you found the findings of irregularly irregular pulse, if you don't have time, auscultation of the heart also not much important, I like to say. If patient does not complain any chest symptom, you can ignore the lung examination also. Okay, and then come to other neurologic down, leg for the jugs, proximal myopathy, you may include or may not include. I mean that what will be our plan of diagnosis? Our plan already we got from the history, probable diagnosis we know. Now look at the book knowledge. Look at the book knowledge. These are the key points. So these are the presentation. Presentation include history and examination both. So what you have planned already in the history and examination, what did we miss? Can anyone say from there in the presentation?
Just miss infertility.
Infertility we miss, very right. That means if we include in the asking, any baby, are you married, right? Do you have partner? Do you have any baby or not? Are you trying for baby? So this is one thing. Anything else left? Nothing left. Nothing left. Okay. This is enough. This is enough for you. So my humble request to all of you, doctor, try to think in this way each and every case. Try to utilize the book knowledge. Okay. In the Graves' disease, to confirm the Graves' disease, you have to examine the thyroid gland. It is a nodular goiter or not. The gland will be the diffuse gland. Diffuse gland. Okay. And any confusion already you have seen in the general examination. Cooperation. Did we mention before, Dr. Manal, cooperation? Right. Cooperation. So if patient have the confusion, usually if it is the elderly patient may be in non-cooperative. So patient may be confused, right? Patient may have the memory problem. These are extraordinary presentation in the elderly thyroid disease. Okay. So already we covered in our checklist. Now you understand the importance of the checklist. Already we discussed the diagnostic signs for the Graves' disease, the goiter, thyroid acropathy also, right? Clubbing, as well as the predibial mixed edema in the leg. So we already finished. And in auscultation already we will get thyroid bruit if it is a Graves' disease. So that we covered. Okay. Now come to other parts of your holistic approach. If you got the diagnosis is not enough, doctor, in your OSCE station. We need to cover any complication. We need to cover comorbidity. So what comorbidity? Already we covered before. Comorbidity means other disease.
Heart failure.
Heart failure is not comorbidity, doctor. Heart failure will be complication of the atrial fibrillation of hyperthyroidism. Comorbidity, other disease means associated other disease. For example, we told about pernicious anemia, autoimmune association, very right. If any findings are there, we have to include, okay? It will be extended diagnosis in the comorbidity. Red flag means organ threatening. Suppose eye threatening finding is vision problem, okay? Red flags. And diabetes also as a permanent disease. It could be a red flag here. Heart failure will be red flag here. Indirectly, you can include some complication as a red flag. If any breathlessness, it could be red flag. How red flag? It compresses the vital functions. That is a respiration. Breathlessness may show underlying heart failure. So it could be red flag, for example, that are accumulated in our checklist, doctor. Here in the down, you see in the right side. This is our developed device for you. This is the checklist. Actually, we are telling it is a focused examination. We corrected in other slide, not here, doctor. Focused examination. So other part, drug allergy, vaccination. If it is a female, pill, pregnancy, it may not be directly relevant with your diagnosis, but it is a routine we have to complete. Impact in daily life, hidden agenda, okay, up to this. So now you are thinking, does it need 1 hour time to evaluate the case? My beloved colleagues, maybe 1 hour time if I am not organized, if I am not rapid to do one after another. To create this thing with us, we need to be serious, doctor. We need to practice every day with the colleagues or come to the discussion classes as well. Otherwise, you cannot make your plan because you will have all fascination to see every examination findings. But all examination finding will not be needed. For example, actually, you need some signs, what we discussed before, from hand up to the leg. Some sign to diagnose hyperthyroidism. Some sign to diagnose Graves' disease. Some sign to say there are these complications. Some sign to say there are comorbidity. Some signs to say red flag. So if I say the some sign, so if you say on an average minimum 2 sign, it will be 10 sign. If you say minimum average 3 sign, it will be 15 sign. But you can create a signs of 30, 40, 50 signs also in these Graves' disease and hyperthyroidism. It will not be time effective for you. For this reason, my beloved colleague, I like to say, try to identify minimum 2 sign or at best 3 sign for each headline. And this is basic, doctor. It is not only the thyroid disease. If any other disease also, we have to say the diagnosis, we have to say the functional aspect of diagnosis, we have to say the complication, we have to say comorbidity, we have to say the red flag. If it is suppose diabetes, if it is your other diseases, okay, chronic disease. In this way, you can make a complete examination plan, doctor. So it will be focused. So now tell me which system we actually covered in this diagnosis. That is the Graves' disease with hyperthyroidism. Which system? First of all, endocrine system. Then, please, doctor, anyone join with me? Cardiovascular. Then, why, Dr. Mahavib, you switched off? Please.
Musculoskeletal.
Musculoskeletal, very right. Then,
The skin.
Skin part of musculoskeletal, doctor, in one way. Very right.
Okay.
Then
Neuro.
neuro, nervous system.
Mm.
Any other? That's enough, doctor. It will make you 100%. Perfect. If we can include in such way, you will have a 100% mark more likely in the exam. But 100% mark needs that thing I discussed. It should be effective examination. It should be complete examination. It will be focused examination. Then you will get near about 100% mark. 100% mark. And management plan, this is not our topic today, details already we discussed in our other session. Now, doctor, let's see. In this video, it will be thyroid examination. May or may not be hyperthyroidism. And you can see, actually in this video, doctor got 8 minutes time. 8 minutes time. But you will get 10 minutes time. In this video, doctor didn't include each and every aspect of our checklist. This checklist. Okay? I'm giving some introduction for a better understanding. Now, doctor, please look at, possibly you will hear the voice also. And if you don't hear the voice of this video, you will inform me, please, by raising the hand or talking. So, doctor, now listen and see. This is a complete examination, like your OSCE station. It will be in the English language. And if you don't understand, doctor, I will describe later. Okay, try your best. Try your best. Don't be frustrated. I am opening this for you.
Hello, Mrs. Andrews. Hi, it's Dr. Thayal. Pleased to meet you. So tell me, how can I help you today?
Well, I've got this.
Doctor, can you hear the voice of the video? Please, quickly. You hear?
Yes.
Very
Yes,
good.
yes.
Yes, continue.
Swelling. It's not very much. It doesn't seem to bother me, but other people have noticed it. Make
Okay,
sure.
and when was that noticed?
Sorry?
When was the swelling noticed?
Oh, probably within the last few months.
All right, okay. Is it sore?
Yeah, it's not sore, it's
No.
not painful.
Apart from this, any other symptoms? Do you feel well in yourself otherwise?
Oh, only that I'm getting older and can't do things as well as I could.
Right, okay.
Tired very quickly.
So you're feeling tired, yeah?
Yeah.
Is that something new or
So-
you've always had?
It's fairly new because I used to make a point of going out every day,
Yeah.
but now I just can't be bothered.
How about weight? Are you losing any weight?
I started losing weight. Again, no reason why I should. I'm not dieting or anything.
Right.
I don't mind losing weight.
Do you know how much you've lost over the, let's say, last 6 months?
Probably about 10, 12 pounds, something like that.
All right, well, that's
Yeah.
quite significant, yeah. Okay. How are your bowels?
Oh, they're fine, no problem with those.
And so no constipation, no diarrhea?
No,
No.
nothing like that.
I can see that you a bit of tremor in your hand. Is that something which you've had recently, or?
Again, it's come possibly within the last year, but it's more pronounced now than it was.
Right.
My right hand has suddenly sort of started it, and it's catching up on my left hand, which is quite bad.
Right, okay.
So,
So we'll have to check that. Any problems with your heart? Any palpitations or, you know?
no, I do have angina, but I do get palpitations sometimes in the early hours of the morning. I'll wake up and it'll be going hammer and tongues sort of thing. I don't know why. I don't know whether I've been dreaming or
And that's a
something
new
like that.
thing as well,
That's,
palpitation?
yeah, again, it's only over the last few months.
Okay.
It's started.
So let's go through the symptoms again. You've told me a couple of things. You've noticed a swelling a couple of months ago. It's not causing any problems locally,
No,
but
no.
you feel quite tired and
I'm more tired than I think
you've
I should
noticed
be,
this
and this tremor is
tremor as well,
yeah.
and palpitations. Yeah.
Yeah.
Okay. Any previous medical problems?
Not really. I had a gallbladder operation some years ago. Other things, minor things, but
Okay. Okay. Are you on any regular medications?
I'm on bisoprol and phenobarbital, aspirin.
So you have high blood pressure as well, yeah.
No, don't have blood pressure.
You don't
My
have
blood
that?
pressure's fine. Yeah,
Okay.
always has been. Yeah.
Right. Okay.
So,
Fine. Any diabetes?
No,
Heart disease?
only angina.
Angina, you mentioned that.
yeah.
Okay, fine. Do you smoke?
No,
No?
used to many years ago.
Right, okay. Fine, let's have a look at this swelling then. Okay, just look straight ahead.
Doctor, I'm asking you now. Can you see the corner, the timing in the history, how many time is spent? Can you see? In the here?
Yes,
3
3:17.
minutes, 3 minutes, 17 seconds. Okay. So at best, in the history, in your typical clinical case, you can spend 4-minute time. Okay. Just as a part of planning. It may be plus minus in general. So 4 minutes. If I can extend 5 minutes, but don't more than that. You may have some other question also, even at the time of examination, even after the examination also. Remember it. Don't think that you will be prohibited to ask any question, because this is your station. It is a complete station. This doctor may ask in between the examination also. Try to follow. Okay. So try to remember this timing. 3 minutes, 17 seconds. I have written also. Now come to the examination. What time he is getting and spending. Follow.
Can you lift your neck up a bit, maybe? Any problems with their eyes at all? Or any problems with their vision recently?
Well, last time I went for a checkup, the specialist did warn me that they're getting worse. And he did a couple of tests.
Right. Okay. And do you know what it was?
He said
was wrong?
There's two things wrong. I can't remember what one is. The other one was aging.
Okay. You just take this glass of water, take a sip in your mouth and hold it there until I ask you to swallow. Okay, and then swallow. Go around and have a feel of your neck if that's okay. Is it sore on your neck at all?
Nope.
Is that sore to touch?
Nope.
No. Okay, just tip your head back for me.
Dear participant, you can make your note also in the paper if you want to ask something after
Just going
examination.
to tap on your chest.
If you want to know that why doctor is doing such and such thing.
Right. And just stretch your hands for me, please. Okay. So feel of your hands. Okay, that's fine. Okay, can I ask you to do like that for me? Just, yeah, keep it there. I'm just going to check the power in your muscles. Keep it there. Okay, that looks quite good. Can you see this finger?
Yes.
Yeah. How many fingers do you see?
One.
One. Could I ask you to follow this finger wherever it goes without moving your head? Yeah. And if you see doubles, let me know. Okay, you have 2 minutes remaining. Okay. Do that again. Okay. Right, Mrs. Andrews.
So doctor, examination basically finished now. Now come to that conclusion and management plan and other. He will tell, we will see a little later. Can I ask you, the doctor ask any other thing, that means a part of the history in this examination time? Who observed it?
Eye, vision.
Possibly he was asking some questions at the time of the examination part, right?
Vision problem.
Yes,
Deterioration of the
yes,
vision.
yes, yes. That I told. After taking the basic history, primary history, you can ask some questions in between your examination. It is possible. Together, you are doing some examination. In the meantime, you can ask some history also. Suppose, do you smoke? Right? Do you smoke? You may ask during examination also. Right. And any other observation, doctor? What we discussed before, hand examination, face examination, neck examination, heart examination, leg examination. Can you remember the doctor has done everything? What do you think? No. Because he didn't look at the leg. Why he didn't see the leg? Patient told he has a nodule in the neck. Okay? Nodule. And it may be a nodular hyperthyroidism because patient have the features of tremor and others. Is not it? Right? Please, someone answer my question. Maybe
Yes.
it is a hyperthyroidism, but patient have nodular goiter, not diffuse goiter. Does patient have exophthalmos?
No.
No. So if there is no, I like to say patient have the nodular goiter, no exophthalmos. So why will it be relevant to see the predibial myxedema? Because we are not thinking Graves' disease. So no need to say in the leg for diagnostic purpose. But if you want to see the leg for the JAKs, it may be justified. Understand my point?
Yes.
In this thought process, you can save your time. That I like to say, precordium examination doesn't need each and everything. Leg examination doesn't need each and everything. Even you can ignore because all other findings relevant with the hyperthyroidism you get even in the upper limb in other part of the body. And this message is important for all of you. Try to build this in your mind. Dr. Hayam, Mike, anything? Oh, sorry, maybe connected. So after this, and other observation also, Dr. Manal, why you are not telling, as we make a plan starting from the hand, it is not the mandatory to start from the hand. As you got some findings in the neck, patient told there is a goiter, you are looking also goiter, you can start from the neck, and he started from the neck. Is not it?
Yes.
Then come to the hand. Then come to the hand. Especially the features of hyperthyroidism, features of Graves' disease is separate. In the hand, when you are looking the clubbing, you are looking the features of Graves' disease. But when you are looking at the warm, sweaty hand and the tachycardia, you are looking the functional status of the thyroid gland. That means the hyperthyroidism. Remember. So, in the history, in the examination, our target is not only diagnosis. It includes etiology. It includes complication. It includes comorbidity. It includes red flags and others. Clear, Dr. Manal? Or other? Please, quickly, someone respond my question. Be connected. Be connected. Okay. Now, come to the...
Hello, Mrs. Andrews.
Sorry.
See this finger? Swelling on the neck and it looks like the thyroid gland.
Examination being ended.
Swelling on the neck and it looks like it's from a thyroid.
Doctor, how many minutes he took? Sorry, actually you are not responding. I lost my course, doctor, in the talk.
Thyroid, because the swelling moves when you swallow.
Helping me, doctor, is
when you swallow. Swelling on the neck.
I missed it, doctor.
Right, Mrs. Andrews.
Yes, up to this maybe examination after. So this is 6:40 seconds. So how many minutes it took in the examination? Maybe 3 minutes 20 seconds around. 3 minutes 20 seconds. So in your planning also in the examination, you may take 3 to 4 minutes. Remember, this is very important planning of timing. 3 to 4 minute time as much as possible. You have to finish your examination. Okay. Now, possibly he will do explanation and management plan. Please have a look how to say the management plan in very short time. Follow.
I think there is some swelling on the neck, and it looks like it's from your thyroid, because the swelling moves when you swallow water, which means that
Right,
it's a
see.
thyroid gland. It's a swelling from the thyroid gland. And most of his symptoms suggest that it might be overactive, because you're complaining of palpitations, a bit of tremor, weight
I
loss.
see.
All these symptoms go with an
With the
overactive thyroid gland. So I think what we need to do today is to request some blood tests to check for your thyroid function. We'll also do some routine tests, check your cholesterol, check your blood counts, and we'll have to do a scan of your neck, because I think there is enlargement of the one lobe, but it might be other lobes which are enlarged. So we
I
just
see.
have to see how much, see it on the scan.
I see.
What we may be looking at is to start you on some treatment to decrease this activity of the thyroid
Some
gland.
medication.
Some medications,
Yeah.
But we'll get all these tests organized, and then we can take it from there,
I see. Yeah.
right? Do you have any questions at this point?
I don't think so. It's resolving a problem, basically. You know,
Yeah.
it's a little bit worrying.
Yes,
But,
I understand, yeah.
So,
yeah.
no, that's fine.
Okay, all right.
Thank you, my beloved colleague. So you see, near about 8 minutes, doctor finished. And it is possible. It is possible. So it needs practice, doctor. So in the management, it includes investigation and there is some other technique of consultation. This is not the time to describe everything. You can again review our video in the YouTube as well. And those who have our basic module, you will get the detail there. Now my question to all of you, can anybody respond? This doctor include investigation in this case, cholesterol. Why included in this case cholesterol? Our case we discussed before is the Graves' disease and hyperthyroidism. But this case is not Graves' disease. The video you have shown now. But this doctor included cholesterol. Is it justified in this case, in this lady?
Cardiovascular risk assessment.
Now, why it is relevant in this patient?
Because she has angina before.
Yes, very good, doctor. Very good. This is the thing. It is called case-related planning. Again, we can say in another word, focused investigation plan, meaningful investigation plan. Okay, I will not tell detail about the investigation. That's enough for you for examination. Focused examination. So, I believe that all of you who attended the session up to this now, you can make a meaningful examination plan for each and every case. It requires your previous knowledge of the disease. Otherwise, you cannot do. Okay. So now, similarly, chest examination, suppose. It may be a plan starting from introduction up to this leg. You see 1, 2, 3, 4, 5, 6, 7. 7 is the chest. And 8, 9, 10. So whole list can give you. But each and everything is not important for your focused examination plan. So we will not show you the video. This is another video with us. And after looking at this video, suppose patient presented with the severe shortness of breath. So after doing this video, the diagnosis will be the COPD, okay? COPD. And again, that in the checklist, you will plan yourself what general examination or observation, what focused or focused systemic examination or local examination required, and what bedside test, or rather to say side room test important. In this way, this is your another message is the utilization of these instruments you need to practice or you need to know. And other examination, doctor hand examination, cranial nerve examination, ER examination, nose examination, back examination for the low back pain, knee examination, fundoscopy. Usually fundoscopy not needed to be done by yourself until today, but in future it may be included. But fundoscopic finding, you need to know. That is the fundoscopic picture. So we have already fundoscopy session. You can get again in the YouTube. And neurology examination, maybe upper limb or lower limb. Okay. Musculoskeletal, especially the rheumatoid hand. Chest examination already we discussed before. Abdomen examination may not be Crohn's disease, maybe other diseases, acute cholecystitis or peptic ulcers. Okay. So complete consultation with examination of the CVS. Complete consultation means discussion and other in this video available. So all the videos, doctor, we included in our module, in the basic module. But in the coming mock examination, actually, mock practice, we are not included the all examination. Those who have orientation of the basic examination technique and other, you will get benefit from the mock practice. Okay. So that all now your question and answer, doctor. Any question until now we discussed up to this? Any question in your mind? You can raise any time. Thank you very much. Thank you very much. May Almighty help us. Salam, doctora. Bye bye.